Now this is the last of the video clips on minerals. It's on the trace minerals, which are the minerals that you need in smaller amounts. So the trace minerals, there's 9 essential trace minerals. Those are ones that are needed by the body, but can't make them, so you have to get them from the diet. Overt deficiencies are rare except for iron, so we're going to focus on that, and we'll talk about zinc as the 2 primary minerals to focus on. The food content does depend on soil content. So just because you look up the zinc content of a food, what you find is not necessarily what is in the food you eat. Animal sources of minerals are generally better absorbed than plant sources, but again, that doesn't mean that vegetarians are going to be deficient. They just need to be more careful about their intake. Okay, so iron, abbreviated chemically Fe, it is the most common deficiency worldwide. In fact, in the U.S., 1 in 5 women has an iron deficiency. Some of you in class probably have been iron deficient. There are 2 types of iron, heme and non-heme iron. Heme iron is associated with hemoglobin in red blood cells, and it is the best absorbed form. About 25% of heme iron is absorbed. So heme iron associated with blood is found in animal products. Non-heme iron is not associated with hemoglobin. It's found in plants, and only about 3 to 8% of non-heme iron is absorbed. So about 10% of the iron you consume is absorbed on average. Again, it's higher if you're deficient in iron or if you need more iron, like in the case of pregnancy. In pregnancy, the iron absorption actually doubles. But pregnant women still are typically put on iron supplements. Things that enhance iron absorption, vitamin C. It's an acid, ascorbic acid. So for people who are iron deficient, taking iron supplements, we recommend that they take them with a vitamin C supplement at the same time. Heme sources, like I said, are better absorbed, and exposure to an acid environment. There's 2 forms of iron. Ferric iron is the more oxidized form, and ferrous iron, the less oxidized form. The less oxidized form is better absorbed, so ferrous iron is better absorbed. A student once told me ferrous is ferrous, so that's how you can remember for your exam that ferrous iron, which is exposed to acid, is better absorbed. Okay. People who've had gastric bypass surgery have trouble with mineral absorption because their stomach's been reduced to the size of an egg, so their minerals are not exposed to that acid environment. So their minerals are in a form that will not be as well absorbed, so they have to take supplements. Things that decrease the absorption, minerals compete with each other for absorption, so an excess intake of one mineral will decrease the intake of other minerals, including calcium. So if you take a lot of zinc as a supplement, you won't absorb as much calcium. Phytates in some high fiber cereals and oxalates will bind calcium, so that it's not, or bind calcium and iron, so that they're not as well absorbed. Tannins in tea. So this is one reason you might want to consider your beverage with meals. If you're concerned about iron absorption, tea would not be the best beverage to consume. But honestly, I wouldn't worry about it that much because tea is definitely better than having a soda. Okay, so functions of iron. Well, actually, let me restate that. If you're iron deficient, don't drink tea with your meals. Functions of iron. It's needed to form the hemoglobin in red blood cells as part of the structure of hemoglobin. In fact, it helps the hemoglobin carry oxygen to the tissues. It's part of the myoglobin in muscle cells, which supplies oxygen to the muscle. It is an enzyme cofactor in energy metabolism. Women need more than men. Premenopausal women need the most, 18 milligrams a day. Men only need 8 milligrams. Now, postmenopausal women only need 8 milligrams a day. Premenopausal women lose iron every month with menstruation. That's why the need is higher. The average intake exceeds the RDA for most men, but it's lower than recommended for premenopausal women. So the deficiency of iron is called anemia, which means lack of blood, literally. And there's many causes of anemia. Iron deficiency is just one cause. For example, I had a patient in the hospital who had a GI bleed. I had another with a stab wound. They had anemia, but it was from loss of blood, not from lack of iron intake. So like I said, 1 in 5 women have iron deficiency anemia. Remember that one of the functions of iron is to help hemoglobin or your red blood cells to transport oxygen to your tissues for energy. Here's a picture of red blood cells that of someone who does not have anemia. They're nice and red in the same color. They're pretty large, but not too large. Iron deficient red blood cells are pale, and they're different size, and they're small. It's called microcytic hypochromic anemia. Microcytic means small, hypochromic means lack of color, because you need iron to make hemoglobin, and hemoglobin provides the red pigment for red blood cells. So iron deficiency occurs in stages. We talked about the stages of deficiency earlier in the semester. When you first have a deficiency, you have some stores, so you can you can still function properly as long as you have some stores to rely on. But eventually, the stores will be depleted, and the body will start functioning abnormally. And then the last stage is developing physical signs and symptoms. So women are more susceptible because of their monthly blood loss in their period, premenopausal women. The symptoms, you're pale because of the lack of pigment, red pigment, tired. That's another typo. It should be mental confusion. Maybe I was iron deficient when I wrote this. Spoon-shaped fingernails or depressions in your fingernails. There's a picture of that right there. Pica, which is eating non-food substances, especially ice. The ice craving can be actually really dramatic, to where people go to, especially Sonic, because they have the best ice, to just get an extra large cup of ice. The diagnosis, low hemoglobin hematocrit, that's done on a blood test called a CBC, but that doesn't show an abnormality until the deficiency or the anemia is advanced. The more sensitive test is ferritin. So if you have the symptoms of iron deficiency, ask for a ferritin level. A lot of doctors don't think about testing for that. When I first became anemic, I had all the symptoms, but my hemoglobin hematocrit were normal, and finally a doctor tested for ferritin, and my ferritin levels were non-detectable. It just hadn't shown up in my hemoglobin hematocrit yet. The treatment is iron supplements and increasing iron in the diet. If you have iron deficiency anemia, dietary alone will not get you back up to where you need to be. You'll need to take supplements for a couple of months. Iron-rich foods, red meat, poultry, especially dark meat, enriched breads and cereals, fortified cereals can have some iron in them, beans, legumes. Cooking acidic foods in a cast iron skillet will cause some iron to leach out of the skillet. And remember that iron from meat and poultry is much better absorbed than iron from plants. Another issue on iron is that excess iron is associated with heart disease because iron can be an oxidant. Okay, it can oxidize LDLs, which is the bad cholesterol. The LDLs that are oxidized are more likely to deposit cholesterol on the arteries. So for that reason, men and postmenopausal women need to prevent iron overload, and one way to do that is to give blood on a regular basis. A toxicity of iron can be really serious, so you don't want to take iron supplements unnecessarily. Hemochromatosis is a genetic disease where you absorb excess iron, and the only treatment for that is to give blood. Okay, so now for zinc, our last mineral. It's essential. It's an enzyme cofactor. It's needed for growth, wound repair, so it's part of our wound healing protocol. Vitamins A, C, zinc, and the amino acid arginine, along with a high protein diet, are our wound healing protocol. So it's needed for sexual maturation, insulin function, and it's important for immune system. So at this time, since we're all concerned about COVID, and COVID enters through, respiratory systems, including the mouth, zinc lozenges may be useful, but not excessive amounts of zinc, because excessive zinc can actually impair the immune system. So zinc deficiency causes a rash, reduces the sense of taste, and I do see this in people with anorexia nervosa, diminished sense of taste. It can cause slowed growth, delayed sexual maturation, depressed immune system. And as far as the absorption, it's like other minerals. It depends on the body's needs. The phytates, oxalates decrease absorption and excessive intake of other minerals, especially iron. So food sources, animal products, fortified cereals, milk, bread, and it's not part of the enrichment process. So this is one of the minerals that vegetarians need to be aware of, especially vegans. People at risk for zinc deficiency, people just subsisting on cereal proteins, alcoholics because it's a mineral that's lost in the urine, people with anorexia nervosa, vegans, the elderly, people with chronic diarrhea and infections, and people with protein energy malnutrition. So the symptoms, poor growth, sexual maturation delay, the reduced sense of taste and smell, and impaired immune system. So you can see in this picture, this kid, if you guess what his age is, I would think maybe 10 at the oldest. He's actually 17. He has stunted growth and delayed sexual maturation because of the zinc deficiency. Now, a toxicity of zinc is going to decrease the absorption of other minerals and increase the risk for heart disease because it can oxidize LDLs. Like other mineral toxicities, it will cause GI disturbance, including vomiting, diarrhea, nausea. And again, this is important because people are touting this as something to take to prevent or treat COVID. An excess amount can actually depress the immune system. So there are other trace minerals that are essential, but I'm not going to go into them because I think this, I've talked about enough for your brain to hold for now, but you do have good resources for the vitamins and minerals that I didn't talk about in detail on Blackboard.